Right, now we are going to talk about the fourth cranial nerve, right? That is about what? Trochlear nerve. Fourth cranial nerve, or we can call it trochlear nerve, right? So we will talk about that what is, from where this nerve originate, right? And what is the course of its nerve and how eventually it reaches where? Superior oblique muscle, right? And if it dysfunction, what happen, right? So first of all, we start with the midbrain, because this nerve take origin from the midbrain. So we will talk about its nucleus first of all, the nucleus of the fourth cranial nerve. Now about the nucleus. Basically, nucleus of the fourth cranial nerve is present in the midbrain in lower part. You know, midbrain has on its back, it has superior colliculus, yes, and it has inferior colliculus, right? Of course, this is cerebral hemisphere, no fun in telling. Now, fourth nerve nucleus is present at the level of inferior colliculus. This is present at the level of inferior colliculus, and here I would love to mention that there is a group of nuclei of the cranial nerve which are in one vertical line, right? These are basically somatomotor fibers. This is general somatic efferent fibers which originate from this nucleus. General somatic efferent fibers which are present in cranial nerves, they eventually innervate the skeletal muscles or voluntary muscles. Now there is a column of the nuclei of the cranial nerve, right, which give origin to general somatic efferent fibers of this vertical column from rostral to the caudal end, right? The highest point is nucleus which is present at the level of superior colliculus in the midbrain, and this is for third cranial nerve. This is for third cranial nerve. And then in the same column below at inferior colliculus, there is which nerve? Fourth cranial nerve. And then if you vertically come down, then in the, what is this? Medulla oblongata. Within medulla oblongata, there is another, yes, third, fourth. But before we go to medulla, pons is there. In the pons, what is this? Sixth cranial nerve nucleus. Sixth cranial nerve nucleus. And in the medulla oblongata, there is a vertically long nucleus, but belong to the same similar function and same column, and this is for the 12th cranial nerve, right? Now what we really see here, that what I'm trying to tell you, that general somatic efferent, right, fibers are present in third cranial nerve, fourth cranial nerve, sixth cranial nerve and 12th cranial nerve. Or we can say these fibers are present in oculomotor nerve, trochlear nerve, abducent nerve and hypoglossal nerve. Right? Now, actually all these are continuation of, these pieces of gray matter are continuation of anterior gray horn. In the spinal cord, you know, there is anterior gray horn which which has the cell bodies which give origin to the axons or fibers which are going to the skeletal muscles. Right? But when the same anterior gray horn column, when it enters into brainstem, it is discontinuous, but it exists as a vertical column, and this column is called, yes, this whole column is called that this is GSE column, right? General somatic efferent fibers, right? Now, I will go into detail of fourth cranial nerve. We already know that third cranial nerve supply most of the extraocular muscle. Fourth cranial nerve supply superior oblique muscle, sixth cranial nerve supplies lateral rectus muscle, and 12th cranial nerve supply most of the muscles related with the tongue, right? Lingual muscles, most of them. There is one exception, we'll discuss that later. So this is exact position of fourth cranial nerve nucleus. But let's go into more detail of this nucleus. If I make a section of the midbrain, at the level of inferior colliculus, then what we can really see there? This is midbrain, right? And now, in the midbrain, we are making a section at which level? Inferior colliculus. And here, there is, what is this structure here? Cerebral aqueduct. And around this cerebral aqueduct, what is here? Periaqueductal gray matter, which is also called central gray matter. Now, if this is the central gray matter, where is exactly fourth nerve nucleus located? Fourth nerve nucleus in the midbrain is present exactly here. What is this? Lateral side, right? So it is, you can say, it is very near to which position? Periaqueductal gray matter or central gray matter in midbrain. Now, from here, fourth nerve fiber course backward. Fourth nerve has three unique things which are different from rest of the cranial nerve. Number one, all cranial nerves emerge from front or the side of the brainstem, but fourth cranial nerve is the only cranial nerve which emerges from the back, right? This is first thing. Secondly, fourth cranial nerve is, as I will explain later, it has the minimum, it is having the least number of neurons as compared to other cranial nerves. And third thing, fourth cranial nerve supplies, because it goes backward, then it decussates here. Because it decussates or crosses here, so it goes to the contralateral superior oblique muscle. So what really happens? From these pieces of gray matter or fourth nerve nuclei, the fiber move backward. This is very unusual route. Normally, from all other cranial nerve, fibers move forward, but from fourth cranial nerve, fibers move backward, and they move backward, go around the, what is this? Central gray matter, and they're moving backward, and then they start going contralaterally, and then they emerge on contralateral side. They exit from the brainstem on the back of it on contralateral side, saying this is the right nucleus, and here it is, yes, left nucleus. Similarly, these fibers also move backward and they also emerge contralaterally. Is that right? Now, when these fibers emerge backward, right, they move around the midbrain, right? They curl around the midbrain, and then these fibers move anteriorly, right? Now they are going anteriorly. And now, in this diagram, what we have seen, position of the nucleus, and there's emphasis that these fibers go backward and they just decussate and exit out of the midbrain, right? And after exiting from the midbrain, right, they curl around the midbrain, or we can say, what is this? What is this structure? Cerebral peduncle. Say they curl around the cerebral peduncle and they start moving forward and laterally. And as they're moving forward, then what happened? Here I want to show you something very important, that, yes, I will show you the arteries, right? First I will show you from the front. I will show the arteries from the front. Let's suppose this is the midbrain, right? And here it is pons, and here is medulla, right? Spinal cord. Now, you know there are vertebral arteries which approach here, and vertebral arteries come together and make which artery? Basilar artery, right? And basilar artery here divide into two parts, that is posterior cerebral arteries. What is this? Posterior cerebral arteries, and here it is cerebellum, and here basilar artery, before its terminal branches of posterior cerebral artery, it gives origin to which arteries? Yes, superior cerebellar artery, and this is posterior cerebral artery. This is posterior cerebral artery, this is superior cerebral artery. The point which I want to mention, that fourth nerve, yes, it passes below the posterior cerebral artery and above the superior cerebral, and it is moving anteriorly from here. This is fourth nerve, right? It will pass in between those two arteries, right? So here in this diagram, I want to show those arteries, right? And how the fourth nerve passes through that. Here I will show basilar artery, okay? This is the basilar artery, and here it is terminal branches. What are these? Posterior cerebral arteries, right? And here will be which arteries? Superior cerebellar arteries, right? Now I will show these arteries. I don't want you to get confused with the fourth nerve, so I'll make it like this, right? This is which artery? Again repeat please. Basilar, and here it is posterior cerebral artery, and here it is superior, yes, cerebral, and this is other side superior cerebral. Now we can see here, this is which nerve going? Fourth nerve. It will pass under the yes, it will pass below posterior cerebral, but it will pass above the cerebral. Here I will show that it will pass below, what is this? And here it will pass, yes, right? So this was a course up to now, that it moved fibers take origin from the nuclei. Important thing, rather than moving anterolaterally or anteriorly, these fibers move backward and decussate and emerge on the opposite side, right? And on the back of the midbrain at inferior collicular, below the even inferior colliculus, here is let me tell you something interesting. Here is a band of white matter, and this is called, yes, who will tell me what is this band called? Superior medullary vellum, right? They emerge through the superior medullary vellum, and it has a collection of a ridge, white ridge here, which is called frenulum cerebelli. So if you want to be really very fussy, you can say that it goes on the back of the midbrain and it emerges out of the through superior medullary vellum on the sides of frenulum veli, right? You must be thinking, what is this white thing? Let me show you. Let's suppose this is midbrain. Here it is pons, medulla, and spinal cord. Here is cerebral liquiduct, and here is fourth ventricle, right? And behind, what is this structure? This is superior colliculus, this is inferior colliculus, and what is this big structure? Cerebellum, right? Here is at this level, here is, this is what? Superior medullary vellum, right? So around, through that it comes out. Now once it comes out, it will move forward, right? Pass between these two arteries, but here I would love to mention another nerve passes also between these two arteries, that is third cranial nerve, oculomotor nerve. Oculomotor nerve also that exists, okay? Let me put the arteries here. This is suppose lower artery. What is this? Tell me rapidly. What is this? Superior cerebral. And if I put it this, what is this? Yes. So what really happens, that here the third cranial nerve passes, and here it will go back and then come around. What is this? Fourth cranial nerve. So third and fourth both passes between these two arteries. The only difference is that third will emerge on the medial side, anteromedial side, and fourth will come from lateral side. Is that clear? Little lower level. Now once the fourth nerve come over here, from here it needs to move forward, and where it will reach, now I will show you that, because next is that it will enter into lateral wall of, it will reach lateral wall of cavernous sinus. right? I've made it in detail. Now I'll make it small, and I will show you eventually how it reaches to the orbit. I'm going to show you the structures from the side. Intracranial fossa, yes, here it is. Middle cranial fossa, and here it is. What is it? Foramen magnum, right? And here was your, what was here? Midbrain, and here was pons, and of course here is medulla and then spinal cord below, right? We have already discussed that fourth cranial nerve, right? I will make middle cranial fossa and anterior cranial fossa a little larger so that, okay. Now, we have already discussed. Now I'm going to show the nerve by green color, right? So this was fourth cranial nerve. It went backward, contralaterally, emerged under it, and reached here. Yes. Any quick problem up to this? No. And it was passing here between the two arteries. Is that clear? Yes. Now, it's approaching, which is this area? Middle cranial fossa. And in the middle cranial fossa, here we have cavernous sinus, right? So I will make the cavernous sinus here, right? And now, this is the lateral wall of cavernous sinus. This is the right-sided structure, right? This is the lateral wall of the cavernous sinus. Actually, fourth cranial nerve, right, will reach the cavernous sinus and it will be found in the lateral wall, right? And in the lateral wall of cavernous sinus, it will be traversing forward and eventually upward. Now here it is passing through the lateral wall. It is not passing through the cavity of, cavernous sinus, because later we will discuss there is another nerve, that is sixth cranial nerve, that passes through the cavity. I told you sixth nerve is for sex, and it has sex with the it has sex with the internal carotid artery. So it passes through the cavity of what? Cavernous sinus. But fourth is not that sexy. So it will pass through the wall of cavernous sinus. But here, what was the nerve here? Third cranial nerve. Now I would love to clear this concept also. I will make these arteries. This is which nerve? Fourth cranial nerve. Fourth cranial nerve. Okay, third cranial nerve. Yes, oculomotor. It all, now both of them are in the same column, but it moves forward and downward, passes again between the two arteries, and it also reaches where? Lateral wall of cavernous sinus. So third nerve and fourth nerve both are present in lateral wall of cavernous sinus. But the difference is that as third nerve progresses forward, it goes little downward, right? So they crosses each other, and here third nerve divides into two divisions, right? But our fourth nerve, it has been in the lateral wall of cavernous sinus below the third nerve, right? But as it moves forward, eventually it crosses, right? Am I clear? So this is third nerve superior division, this is third nerve inferior division, but this is our fourth cranial nerve, right? Here, I also want to make one thing more clear, that what is this here? Okay, I will just make it more clear. Yes. Which ganglion? Trigeminal ganglion. Here it has which division? And here is maxillary, and here is mandibular. Now, what is this division now moving forward? Yes, ophthalmic division. And what is this division going? Maxillary division. So actually third cranial nerve, fourth cranial nerve, and ophthalmic division of trigeminal and maxillary division of trigeminal, all of them are passing through the lateral wall of cavernous sinus from top to down position. Is it clear? Okay. Okay, now we can say that fourth cranial nerve, when it was in the lateral wall, it is below the third nerve and above the ophthalmic division. Is that right? It is below third, this one, and above the ophthalmic division, this is our fourth. Now once it reaches here, from here it needs to enter into orbit. It needs to enter into orbit. So how it will enter into orbit? Through the superior orbital fissure. It will enter into orbit through superior orbital fissure. Now, superior orbital fissure, let me draw it here, right? Now it needs to enter there, superior orbital fissure. I'm going to draw, of course, right orbit, right? And this is, and here, this is your orbit. Now, this is superior orbital fissure. From inside, you know, there is a tendinous ring. There is a tendinous ring. Okay, let me make it a slightly different angle so that it becomes more clear. I will make the posterior wall of the orbit like that. This is the optic canal and this is what? Superior orbital fissure. And if this is the optic canal and medial part of superior orbital fissure, they are part of a ring. What is this ring called? Superior, this is called tendinous ring, right? Now, this is the outside the tendinous ring, this portion of superior orbital fissure. This portion is called lateral part of superior orbital fissure, right? Actually, fourth nerve is very important to remember. Fourth nerve will pass and emerge through this area. So it is outside the tendinous ring and it is emerging from the lateral part of superior orbital fissure. Is that right? Now, in superior orbital fissure, if I make arrangement of the nerves which are passing through that, this is tendinous ring. You should write here LFTs. LFT stand for what? Liver function test, right? This is lacrimal nerve, lateral most. Again, I will say, you just remember LFT. So, lacrimal nerve, then frontal nerve, and then trochlear nerve. It's so simple. So, basically, we can say trochlear nerve as it approaches, exit from lateral wall of cavernous sinus, it finds itself just behind the lateral part of superior orbital fissure, and there it enters into orbit. This nerve enters into orbit, right? Of course, after entering orbit, exactly what is its position? It is outside the ring and medial to the frontal nerve. Once it is there, now it has to approach what? Superior oblique. Now let me draw the superior oblique. If this is the eyeball here, let's suppose this is the eyeball. Now, superior oblique, this is suppose medial wall, right? Now, superior oblique takes origin from, yes, body of sphenoid from here, and then it is moving like that. This is the belly of the superior oblique muscle, right? And here, okay, under it, there is another muscle. What is this muscle? Levator palpebri superioris, which will elevate what? Upper eyelid. And then there is another muscle here. What is that? Yes, this is superior rectus. Okay, I will draw it a little more downward so there is enough space for these muscles. Okay, so here is the eyeball, right? Here is your upper eyelid, right? And of course you do have lower eyelid. Now arrangement of the muscle. Here is the muscle. What is this muscle going? Superior rectus. Superior rectus. What is this muscle? Levator palpebri superioris. Levator palpebri superioris. Now here is the muscle. What is this muscle? Superior oblique. But the important thing is that there is a, from here its tendon will turn differently. I will make superior oblique slightly different so it stands out of other muscles. From here its tendon of superior oblique, there is a trochlea and it will come and it will pass under the, what is this? Superior rectus, and eventually it will attach to the sclera, right? So this is superior oblique tendon, and yes, here there was a fibrocartilaginous, what is this fibrocartilaginous? Trochlea or pulley. Trochlea means pulley, right? So I will make whole this muscle with a different color so it does not confuse you at all with other muscles. Am I clear? This is your superior oblique muscle. Now, this nerve, these two muscles you can extend backward. They are attached over there. Now, this nerve, when it enters into orbit, it moves upward. What it does? It moves upward and medially passes above these muscles and reaches to, what is this? Superior oblique muscle, right? And supplies the superior oblique, right? This is how this nerve starts and eventually reaches to its destination. Is it clear? Now, what are the special points related with the fourth nerve? Number one, fourth cranial nerve is the only cranial nerve which exits from the dorsal aspect of the midbrain. Point number one. Number two, it is the most slender cranial nerve with the minimum number of fibers. Number three, it decussates and supplies contralateral muscle only. I mean, nucleus, the right nucleus supplies fiber to the left nerve which supplies the left superior oblique, and left nucleus fibers come to the right side and supply the right superior oblique, right? Then another important thing, this is the cranial nerve with the longest intracranial portion, right? Because it has to intracranial portion, it exits from here, then all the way around the midbrain, then through the cavernous sinus up to the superior orbital fissure. So all this is intracranial course. It has the longest intracranial course. Another thing which I will love to mention, usually how it is damaged. Yes, please.
How to compare with sixth cranial nerve? I think that course is also.
Yeah, that sixth cranial nerve also has very long course. But why that produces false localizing sign we will discuss later. Is that right? Fourth cranial nerve has longest intracranial course. Sixth cranial nerve has longest intradural course. We will discuss that later. Okay? Now, let's come back. Now, another way to, now I will draw this nerve from another angle but rapidly, right? We will show the both nerves. Now, there is going to be a drawing and I will see if you really understand or not, right? And then we will talk about its liens. Now, I will show you this nerve bilaterally. Now, I will show you this nerve bilaterally. Here is your cranial cavity. Here happens to be your beautiful nose, and you do have ears, right? Here is, what is this structure? Dorsum sali, right? Yes. Anterior cranial fossa, middle cranial fossa, yes. Posterior, middle cranial fossa and posterior cranial fossa. And here was your midbrain, from where this nerve will emerge. Is that right? Now, and here is what structures. There was one structure here. What was this?
Cavernous sinus.
Cavernous sinus. And here is also that structure. And what is it? Cavernous sinus. Here was your friend sitting, pituitary gland.
Yes.
Right? Here I will show you the orbit. What is this? In the orbit, I have removed the bone from the top to show you the eyeballs. Is that right?
That's right.
And here I will show the muscle, yes. What was this muscle? Superior oblique, which passes through a pulley and then attaches here.
With the circular.
Okay, what is this? Superior oblique muscle. Here also I will show you what is this muscle. And from here, what is this? Superior oblique. Is that right? Now, how the fourth nerve will start? Now we'll draw very rapidly. And here happens to be your what? Artery with which branches? Posterior cerebral and superior cerebral. Now look. And here was your cerebral liquid duct. Now fourth cranial nerve. We'll draw it bilaterally. What are these? Nuclei. And they decussate and then emerge on the opposite side, and then they curl around and move anteriorly. They pass below which nerve? They are still in subarachnoid space, and they pass below posterior cerebral, right, and above. Yes, and from there they will approach to where? Lateral wall. They will approach the lateral wall, and through the lateral wall they will move forward. Yes, they will be passing through below third nerve and above the ophthalmic domain. And from here, what was this? Superior orbital fissure, right? This was your optic canal, and it will enter from here and from lateral part. Then inside it will move medially and eventually supply superior oblique. Is it clear?
That's right.
Really? Now, lesions. What can damage this nerve? But before really you go for lesion, what is the function of this muscle? Because basically it is supplying the superior oblique.
Yes.
What is the function of superior oblique? I will show you by eyeball. Let's suppose, yes, let's suppose these are my eyes. Just suppose, even though my eyes are more beautiful than calves, but still, right? It's like this. But I will keep them little down, right? Now, I will keep only right now my right eyeball I'm having in my hand. Now, if you see the position of superior oblique, this is my right, okay? Superior oblique will come from here, move, and then it will go backward. And when it is moving backward and laterally, its tendon will attach on the back of the eyeball,
Yes.
posteriorly and laterally,
That's
right? Now, when this muscle will contract, look here. When this muscle will contract, like this, in this direction, when this muscle will pull, tendon will be pulled in that direction.
That's right.
Is that right? So this back of the eyeball will be pulled up and front will rotate down. So what this is exactly doing, that this tendon now again, this is a muscle going, and here tendon come back. When this muscle will contract, number one, it will elevate the back of the eyeball, so front will go down. So this depresses the eye. Number two, because it is attached on the back, right, and coming from the medial side. So when it will pull the back on the medial side, front rotate laterally. So this muscle, superior oblique, I'm talking about the right now, right, its tendon is attached on the back and also attached, approaching from the medial side, on the back. So it elevates the back, so front depresses, number one. Number two, when it pulls it medially, eye rotates laterally. So basically, one normal function of superior oblique is that it pushes the eyeball down and out. It pushes eyeball down and out, right? Now, but this is not the complete function. It has one more function. It spins the eyeball also. But before I go for spinning of the eyeball, I will explain the movement of the eyeball. This is my right eyeball. If it moves like this is depression of eyeball, this is elevation of eyeball, again depression of eyeball, yes, abduction of eyeball, looking outward, and adduction of eyeball, right? Now, another movement is there. Eyeball can rotate, and not only rotate up and down or in and out, it can also spin. For example, look at here. It can spin like this and this. If this is considered 12 o'clock position, this handle, right? This is the 12 o'clock position of the iris. Eyeball can spin also. If it spin inside, it is called intorsion. If it spin outside, it is called extorsion. So what we can say? Now again, please focus on this area, right? That eyeball can not only move down and up, it can also move nasally and outward, and it can also spin in. This is called intorsion, and it can spin out. This is extorsion. Now, actually what happened, superior oblique tendon, when it comes and attach here, when it pulls, not